Assalamu alaikum warahmatullah. Today we're talking about regulation of aldosterone secretion. We have 4 factors that can control the secretion of aldosterone. 2 of them with a strong effect and 2 others with slightly or little effect. So, increased potassium ion and extracellular fluid have greatly increase of aldosterone secretion. So it's have a power effect on the secretion of aldosterone and activity of renin-angiotensin system. This system lead to increase angiotensin 2 and the final one can lead to greatly increase of aldosterone secretion. While the increased sodium ion in extracellular fluid have slightly decrease of aldosterone. So it have inhibition of aldosterone but in slight effect. And ACTH, hormone secreted from pituitary gland, from anterior part of pituitary gland, and this hormone also lead to control the secretion of aldosterone, but in little effect also. So, potassium ion and angiotensin, both of them lead to have a powerful effect on secretion of aldosterone, while sodium ion and ACTH have a little effect. All of these factors lead to increased secretion except sodium ion cause inhibition of secretion of aldosterone if there is increase in sodium ion in extracellular fluid. Now we're talking about glucocorticoids. After we finished talking about the mineral corticoids, now talking about glucocorticoids. 1. From function of glucocorticoids, effect of cortisone on carbohydrate metabolism. Cortisol causes stimulation of gluconeogenesis. Gluconeogenesis means building of glucose by liver. Can increase from 6 to 10-fold under the effect of cortisol. Decrease glucose utilization by cells and elevated blood glucose concentration and occurs of adrenal diabetes. So cortisol lead to building, conserving of glucose in the body, especially in the liver, and lead to, by this cause, to adrenal diabetes. Administration of insulin lowers the blood glucose concentration only a moderate amount in adrenal diabetes because the tissues are resistant to the effect of insulin. We have 2 types of diabetes. Diabetes caused by defect in the pancreas and diabetes caused by increase of cortisol secretion. In case of pancreas defection, insulin administration as drug can be resolve the problem, can be treatment the diabetes. But in case of adrenal diabetes, by the cortisol as causing, in this case the diabetes not respond to insulin as drug because tissues are resistant in this case to insulin effect. 2. Effect of cortisol on protein metabolism. What's the effect of cortisol? 1. Reduction of protein in cells. So reduction in cellular protein, causing muscle weakness for immunity. Also, cortisol increased liver and plasma protein to enhance the synthesis of protein by the liver and increase blood amino acids by mobilization of amino acids from non-hepatic tissue to hepatic tissue. So cortisol will accumulate the protein, accumulate the amino acids from all tissues, and keep protein and amino acids in the liver to synthesize more and more proteins. In this case, muscle become weakness because protein moving from it and transport to the liver by cortisol effect, and also that lead to decrease the effect of powerful of immunity. So cortisol in high concentration secretion lead to decrease of immunity. And if anybody take cortisol as a drug for any cause, also that lead to muscle weakness and lead to immunity decreasing or become less effective, less powerful. Effects of cortisol on fat metabolism. Cause mobilization of fatty acids from adipose tissue and cause obesity by excess secretion of cortisol. And that because of stimulation of food intake or increase of appetite, and so that cortisol lead to obesity. Cortisol is important in resistance stress and inflammation. From benefit of effects of cortisol is resisting the stress and inflammation. It's a good side for cortisol. And stress, ACTH immediately secretion from adrenal pituitary glands, anterior of pituitary glands, and by effect of ACTH, within a minute there is secretion of cortisol. Some of the different type of stress, trauma, almost any type of trauma, infection, intense heat or intense cold, injection of norepinephrine, surgery, injection of necrotizing substances under the skin or beneath the skin, and any debilitating disease. All of these, any type of stress, any one of these 7 types of stress or others lead to secretion of ACTH directly by pituitary glands, and ACTH will cause stimulation for secretion of cortisol. Anti-inflammatory effect of high level of cortisol. Cortisol has 2 basic anti-inflammatory effects. One, it can block early stage of inflammation process before inflammation begins. But if inflammation already begins, it causes rapid resolution of inflammation. So it's good for in 2 cases, either prior the beginning of inflammation, and even inflammation begin, it's caused to resolve this inflammation. It's become the healing from inflammation faster. Six factors or effects of cortisol. Cortisol prevents the development of inflammation by stabilization or stabilizing lysosomes and by other effects. So cortisol stabilizes lysosomal membrane and decrease permeability of capillaries, decrease migration of white blood cells into the inflamed area, and phagocytosis in the damaged tissue, and cause suppress of immune system, as we said in the first point, and causing reduction of lymphocyte reproduction. Cortisol also attenuates fever mainly because it reduces release of interleukin-1 from white blood cell. So in general, cortisol causes inhibition or decrease the effect of inflammation factors and the powerful of immunity system. If cortisol secreted in high quantities in the blood, or if it taken from outside as drug, for example. Cortisol causes resolution of inflammation in specific cases: rheumatoid arthritis, rheumatic fever, and glomerulonephritis. Specific diseases, we can use cortisol as drug. In this case, cortisol is very benefit. Inflammation begins to subside within 24 hours of its administration. Cortisol doesn't correct the basic disease condition, but prevent damage effects occur in case of response of inflammation factors. This alone can often be life-saving measure. That means when there is a powerful response of inflammation to the defect, the inflammatory factors can cause a harmful effect on the cells itself and the body cells. So cortisol, when suppress these factors, can decrease the harmful effect of these factors or effect of inflammation, and then can keep the cells away from this bad effect. Cortisol blocks inflammatory response to allergic reaction. Also, it causes an allergic reaction. The basic cortisol effectively prevents shock or death in anaphylaxis, which otherwise kill many people. So the allergic reaction is a very dangerous reaction. It can occur in anyone have a sensitivity for anything. We can use cortisol to inhibition this reaction, so that we can prevent shock or prevent death and keep the health of the body for the patient. Effect on blood cells and on immunity, infectious disease. Cortisol leads to decrease the number of eosinophils and lymphocytes in the blood and suppress immunity. That's a good in case immunity become more than the body can need it. Sometimes immunity becomes stronger than it's needed from the body or by the body. So it's useful drug in preventing immunological rejection of transplantation. Cortisol increases the production of red blood cells by mechanisms that are unclear. When excess cortisol is secreted by adrenal gland, polycythemia over result, and conversely, when there is decrease or no secretion of cortisol, anemia may be occurs in the most cases. So there is a direct relation between number of erythrocytes and amount of the cortisol in the blood or secretion of cortisol in the blood. Now we talking about adrenal androgens, the third type of hormones secreted from adrenal cortex. Adrenal androgens, dihydroepiandrosterone, and progesterone and estrogens. Abnormalities of adrenocortical secretion. What can occur if there is secretion, oversecretion, or in more amount from the adrenal gland? Can occur a special disease called Addison. This type of disease caused by primary atrophy of adrenal cortices. It's autoimmune, tuberculosis, and cancer. Mineral corticoid deficiency. Lack of aldosterone secretion result in decreased extracellular fluid volume, hyponatremia or hyperkalemia, mild acidosis, decrease plasma volume and increase RBC, cardiac output decrease, and shock and death within 4 days to 2 weeks if there is no treatment. So Addison occurs if there is deficiency in aldosterone, if there is deficiency in mineralocorticoid hormones. And these are the symptoms or signs of Addison disease, all of them related with the deficiency of aldosterone. You can understand them when you remember the effect of aldosterone. If there is no aldosterone, so any effect can occur by this hormone become reverse, and that will be lead to death if there is no aldosterone treatment. Glucocorticoid deficiency, loss of cortisol, cause hypoglycemia, muscle weakness, deteriorating effect or response to different types of stress, and even mild respiratory infection can cause death. Addison disease, we said, is caused by decrease or lack of aldosterone. Not this cause only, but there are other causes, is deficiency of glucocorticoids. So we have two main causes for Addison disease, caused by deficiency of mineralocorticoids and glucocorticoids. So there are signs of result from decrease of aldosterone, and these signs or symptoms result from deficiency or absence of cortisol, mainly glucocorticoid deficiency. Melanin pigmentation. Another characteristics of the most people with Addison disease. A specific characteristic for this disease is melanin pigmentation of the mucous membrane and the skin. Treatment of people with Addison disease, small quantities of mineralocorticoids with glucocorticoids administered daily. Extra glucocorticoid doesn't need it in time of crisis. That means Addison disease is a general disease for any deficiency in the or any defect in the first and second layers of adrenal cortex. That means if there is defect in the first layer, cause deficiency of aldosterone or mineralocorticoid, and if there is any defect in second layer, that means deficiency of cortisol mainly, both of them caused Addison disease. Addison disease has lots of symptoms related with deficiency of aldosterone, symptoms related with the deficiency of cortisol. In addition to, there is a pigmentation in the mucous membrane and skin. This specific signs for this disease, we can see them as points or dots on the skin of the patient. And this disease is not dangerous if you can treat the patient in early stage, but it become a high mortality if the patient doesn't treat it, and that may lead to death of the patient. Hyperadrenalism or Cushing syndrome. It's adenomas of anterior pituitary and abnormal function of hypothalamus, or its ectopic secretion of ACTH by tumor, or adenomas of the adrenal cortex. All of them the causes of this drug, Cushing syndrome. As you see, all of them related with the cancer. Maybe in anterior pituitary, that may lead to increased secretion of ACTH, or cancer in the or abnormal function of the hypothalamus lead to increase of ACTH also, or ectopic secretion of ACTH by any tumor, or in adrenal cortex, adenoma or cancer in adrenal itself, all of them leading to hyperadrenalism, mean increased hormone secretion of hormones of adrenal gland. So Cushing syndrome characterized by buffal torso, edematous appearance of the face. It's like moon face. It's called patient with moon face. Become a circle, swipey. Act and hirsutism, excess growth of facial hair. 80% of patients have hypertension and hyperglycemia and muscle weakness and large purple striae, suppressed immune system, severe osteoporosis. All of these, as you see, related with increase of cortisol. Increase of cortisol, either it's result from the body itself, from hypothalamus, or from pituitary gland, or from adrenal itself, or patient can take them for treatment some disease as anti-inflammatory or anti-allergic disease. The patient required for take cortisol, and if the patient continues with this drug for a long period, the side effect of this drug, cortisol, occurring of Cushing syndrome. Now finish. Thank you so much.